Now, without further ado, I want to introduce our speaker for today, Dr. Karen Simone. She's the director of the Northern New England Poison Center, which serves Maine, New Hampshire, and Vermont. She's an assistant professor of emergency medicine at Tufts University School of Medicine, and a certified specialist in poison information. And we have had her for some webinars in the past, and very excited to learn from her again today. So Karen, it's all up to you, and take it away.
Well, thank you. Hopefully I'm not muted now. Is that correct?
We can hear you. Yep.
Okay. Good afternoon, everyone. I am here to talk to you about marijuana, THC, CBD, the medical, the recreational, and everything else, and how all of this can affect the people that you work with or have as clients every day. My information is up there. My doctorate is in pharmacy. I'm a diplomat of the American Board of Applied Toxicology, which basically means I'm a clinical toxicologist. And I've been in poison control for about 30 years. So everything that I present to you today will be in the eyes of a pharmacist toxicologist who has to deal a lot with people who get into trouble, mostly that they weren't trying to get into. My information is on the screen. I think you can see my mouse. This is my personal, well, my workplace phone and email. If you ever have an emergency, the 800-222-1222 line that is in the lower right-hand corner of every slide is where you should call. It's a 24/7 way of getting a hold of nurses, pharmacists, and physicians any time of the day or night, 3 a.m. on Sunday on a holiday, we're there. Also, our website, nnepc.org, is there. We have a lot of information up there on poisoning related to COVID and all kinds of substance use substances. So if you have a problem, hopefully we can help you. If in doubt, ask. The worst we can say is no, we don't know anything about that, but we try not to say that very often. Our objectives, and I'll just say I really don't have any conflicts to talk to you about. We're a nonprofit organization, and I don't have interest in anything that would matter with regard to this presentation, or really any of the ones I make. With regard to objectives, we're going to talk about the relationship between marijuana, THC, and CBD. I think that's a key thing that we want to accomplish today. And with that, we're going to talk about the clinical effects. And I think that the easiest way to do that is to look at prescription CBD, because we know a lot about prescription drugs. They have to be studied before they can be marketed, unlike the non-prescription CBD products, which are just out there regardless of knowing very little about them. So thank goodness for the prescription product that gives us a little bit of help. I'm going to compare and contrast the clinical effects of THC and CBD a little bit, and then I'm going to talk about some of the concerns about your THC and CBD and mixing that with medical problems or medications and how that might be an issue, because at the Poison Center, we are seeing that become a problem sometimes, especially a lot of well-meaning young adults and not so young adults seem to think that their elderly parents with all sorts of medical problems and usually medicines to go with those should use this natural CBD or THC to help them with their medical problems. And it has created some problems, especially the THC containing products. And then we're going to talk a little bit about CBD and marijuana urine screens, because there's a lot of concern about, CBD supposedly is okay to use, THC for at least some professions or some patients or clients is really not probably okay to use. And so can you tell the difference if you're doing any kind of compliance monitoring, urine screens, that kind of thing, which is THC and which is CBD? So I think that's kind of important. And some of the areas that I'm going to be talking about today are still developing. I'm going to be giving you my opinion based on my clinical experience and research that I've done pursuant to all kinds of questions, legal questions, social services questions, what do I do with this patient in my emergency department questions. So, you're going to get my opinion based on all of the cases and the research that I've been able to review. So I just want to start and see if you guys can give me a little bit of audience response. I don't know if you can see my face. I think you can. I can't see yours. But if you have an iPhone or some other kind of phone, if you could go to your texting mode and you want to text to the number 22333. And when you go down to the message box, I want you to type all in caps, MMCDME. Michael, Michael, Charlie, David, Michael, Edward. And yeah, I know that's not EMS or police or military designation, but I figured you would get it. So right now, as soon as you text to the phone number 22333, and then you put in the box instead of words, MMCDME, all in caps, it should send you a message back to tell you you're in. And then if you could just pick one of the responses up here, I'll know that some of you guys are in there. And the first question is, how do you like virtual learning and webinars? I don't know about you, but I kind of miss real people. Although this is really convenient. I don't have to drive anywhere. I don't have to park. It's cheaper. But, you know, it's hard talking to people and you can't see their faces out in the room. So I know at least some of you are able to log in and give me responses. So I'm going to point out a couple things. First of all, I do not know who is responding in what way. I use this to see if you're still awake, since I can't see your faces, and to see if whatever, sometimes I'll ask you a question to see what your baseline knowledge is. And sometimes I'll ask you a question to see if what I just think I taught you is what you actually took home. So it helps me to know whether I'm sending you the proper messages based on my understanding of science. So if you can answer, I don't know who you are. I don't care if you're wrong. I just really want to know if you're alive and paying attention and getting the message I'm trying to give you. So my first question is just a baseline knowledge question. How important is cannabidiol, or CBD, content in marijuana? If you don't know what CBD is, that's an obvious answer. It's not important unless you're treating seizures. That's what the prescription CBD is used for. It's possibly important to temper psychosis and other unpleasant effects that come from the THC in marijuana, and it's not helpful. It doesn't have any known effect that would be useful to somebody who likes using marijuana, which is what some people think for sure. So I'm looking kind of for a baseline level of knowledge. Okay, so I'm going to tell you, some people believe that D is correct. Who really needs it? A lot of people just don't know. In terms of treating seizures, you could make the argument that it's only important for treating seizures. But I would say to you that if you're smoking marijuana to get high, you're just trying to get high on marijuana, the marijuana plant has THC and CBD in it. And we do believe that you're getting high from the THC, but the CBD can help with some of the kind of negative effects of THC. And I can tell you from poison center cases with people who have only THC products, we think, because we never know for sure, or people who just have too high of a dose, it can cause some very scary, unpleasant, paranoid thoughts and hallucinations. So I think the CBD actually probably is important. The science isn't awesome on that, but there is some science to suggest that. Now, what exactly is cannabis? So many words: marijuana, cannabis, THC, CBD, what's what, and how do you know? So these are pictures of the plant, Cannabis sativa. And you can see on the upper left, it's a grow room indoors with grow lights and everything like that. I can tell you, I've gone to, in Colorado and Denver, when recreational marijuana was new, a facility that had hydroponic marijuana plants that were taller than I am. I'm only about 5'3", but still, that's a really big marijuana plant. And then on the right side on the top, you see the dried version. And then on the bottom, you see a sort of a green leafy plant version. So all of those look the same. So let's start to distinguish what is, well, I mean, they are different forms of the same plant is what I meant to say. So what exactly is cannabis, the plant? It's dry, well, when we're buying, I showed you the plant. A lot of times when you're going to smoke it, you're going to buy a dried version of the plant. So when you're buying cannabis, the dried version of the plant, it's leaves, flowers, etc. Hemp is also from the plant. The actual plant has more than 500 ingredients in it, and more than 100 are cannabinoids, which are things that can go into your body and interact with various receptor sites. Far and away, delta-9 tetrahydrocannabinol, which is THC, is the one that is responsible mostly for the high and the one that impairs cognitive and motor functions if you're trying to operate heavy machinery or climb on a ladder or do anything that might be dangerous physically if you're high. Also, we believe it's the part that causes anxiety, psychosis, and some issues with memory. CBD, which is also present in a large dose, seems to be an anticonvulsant, so it helps with seizure prevention and management. And then we also think that it may protect against some of the negative effects of the THC. Some of you may have heard of K2, which is a type of synthetic cannabinoid. Those are not from the plant. Those are things that were developed in a lab and somebody made to study receptor sites, and then a bunch of kids and young adults and other folks thought would be fun to get high with, but they have really nothing to do with the plant other than someone looked at the active components in the plant and decided to go to a lab and make stuff that looks chemically just enough like it to hit receptor sites. Not enough like it to make the urine screen positive, though, interestingly enough. So let's talk a little bit more about the plant, because already I think this is so confusing. So we have cannabis, the plant, Cannabis sativa, and that has THC in it, which is the tetrahydrocannabinol, and cannabidiol, which is the CBD, and then a bunch, hundreds of other things, over 100 of which are also other cannabinoids. THC and CBD are cannabinoids. They're just things that have a somewhat similar chemical structure, some of which are active and some of which are not, and we don't even completely understand those. But the important ones for today and really for you are going to be the THC and the CBD. Now, if you head off to the right into the, well, cannabis-related compounds, those are things that are based on in a lab that you can make based on the THC and CBD and components in cannabis that we think do things. So if you look at these chemicals in a plant and go to a lab and say, gee, I'm going to make something that looks just like something that's in the plant, then that's, we have some prescription drugs, dronabinol and nabilone, that are based on that. They're not from the plant, they're not natural. We make them in a lab, but the dronabinol is the same as what the plant has in it, and nabilone is similar but not exactly the same. Now, if you go off to the left side, those are cannabis-derived compounds. So what is the difference? These are compounds where you take the plant and you take stuff out of it, as opposed to on the right side when you just go to a lab and say, okay, I'm going to make something from scratch that looks like that. So if you go to the plant, you're basically taking the plant and making an extract or some kind of natural something from the plant. And if you do that, typically there will be THC and CBD both present, although there are multiple ways to do that, and it's possible to have almost no CBD and almost all THC in what you're getting out of the plant. So I'm going to say this one more time because I know it's confusing. This is cannabis, the plant. It has THC and CBD in it and all kinds of hundreds of other things. If you go to a lab and try and make stuff that looks like these natural things in there or might be exactly the same, those are the cannabis-related compounds. They're completely synthetic. They're not natural. They just look like the natural stuff. The cannabis-derived things are when you make things from the plant. So if I soaked a plant in alcohol and took stuff out of the alcohol that had some of the things from the plant in there, that would go here. If I'm going to make concentrated THC by putting a bunch of plant in a container and putting butane lighter refill, forcing that through it and having liquid come out the other end, that would be a cannabis-derived compound because I'm pulling it right from the plant. So I hope that makes sense. Honestly, it doesn't make a ton of difference when people are getting high. I think what's more important is, does it have THC? Does it have CBD? Does it have both? How much of each? And that's really a little bit more important. Now, if you're not already confused, I'm going to make you even more confused. And I think this is kind of partly the process of what we're doing today. When we have marijuana, first of all, marijuana has been illegal for a very long time, decades, over 100 years. At one point, we decided when we developed the Drug Enforcement Agency's Controlled Substances Act and regulations related to it, we made marijuana a Schedule I. And basically what a Schedule I means is it is not legal for anything. Maybe you can write a special request and do some research with it, but it's not legal for any kind of use. That's Schedule I marijuana. Federally, marijuana is still a Schedule I controlled substance under the Controlled Substance Act, and the Drug Enforcement Agency is in charge of that. It's a federal crime to grow it, sell it, or possess it. So this is a fact. Now, you know that you can buy marijuana all over the place legally. Well, why is that? It is still federally illegal, but various states, one at a time, under their rights as states, have decided that they're going to legalize marijuana either for medical use or for recreational use in their states. For instance, in the state of Maine, it is legal to use marijuana medically. There's a process you have to go through, and you can use it recreationally. So still, even though we can do that in the state of Maine and a lot of other states, Washington, California, I mean, a lot of states have it legalized now. Not New Hampshire for recreational use, but Maine, Massachusetts, I think Vermont, you know, so a lot of states. So when we're using it legally in the state of Maine, it's federally illegal. The only reason we can do that is that several years ago, the federal government said, all right, we're not going to come and get you if that's what you want to do. So they could if they decided to, but they've chosen not to do that. So we're still federally illegal while we're using our state legal cannabis plant to get high or for medical reasons or whatever the reason is. In addition to that, things have gotten a little bit more complicated. In 2018, there was this farm bill that came out and said that we're going to put hemp under agriculture as a commodity under the U.S. Department of Agriculture. What is hemp? Hemp is still cannabis plant. They're both, marijuana and hemp are the same plant. The only difference is you can adjust the plants. You know, if you go to a garden center, you can have all different kinds of flowers, and experts can make the flowers look 100 different ways and adjust how big they are and what temperatures they grow in. Well, you can do the same thing with marijuana, and you can adjust the amount of THC in there. And so hemp plants are, by definition, if you get the dry weight of the plant, they have to have less than or equal to 0.3% of THC in them. So very low THC percentages. So if it's less than or equal to 0.3 dry weight of THC, it's hemp, and it falls under the Department of Agriculture. If it's more than that, it's marijuana, and it's federally illegal, and it falls under the Controlled Substances Act, which the Drug Enforcement Agency works with. So very little THC, less than or equal to 0.3%, it's hemp. It's an agricultural commodity, and Department of Agriculture controls it. If it's more than that, it's a Drug Enforcement Agency federally illegal drug, which is legal in our state. Are you confused yet? It's very confusing. And then the Food and Drug Administration, as soon as this stuff started going on, and even before, people were selling CBD. And CBD is, you know, you should be getting CBD from hemp plants, and there should be very little to no THC in there. And you know, people were putting it in food and dietary supplements, you know, those things that you can buy at the health food store, at your grocery store, market, and they're, you know, doing all these things with them. And the Food and Drug Administration said, wait a minute, the farm bill is to grow rope and textiles and all these things down here under fibers. That doesn't mean that we think it's okay for you to put it in food and sell it to people to eat. So the FDA is still taking that stance of it's not legal to market it, put it in food or dietary supplements, or to send it from one state to another as you're selling this stuff across state lines. Well, it's out there. So there's this very strange federal regulation and then what we do in our state. But I think the important take-home messages for you guys are hemp has very little THC in it, almost, you know, just small residues of THC. If you smoke a hemp plant, I wouldn't be expecting any good kind of high from that, right? If you want to get high, you need to smoke a marijuana plant and get up into the 10, 12, and higher percentages these days to get high. So nobody's going to smoke hemp and get a good high. You might as well smoke a banana peel, in my opinion. You know, once you have these products, you can make all kinds of, you know, products, foods, beverages, cosmetics, things like that. If you go to Ulta or Sephora, one of those beauty stores, you know, you can get hair products and shampoos and hand lotions that have hemp and CBD and all kinds of stuff in them. So I want to test to see whether you learned anything from this. How much THC is hemp allowed to contain and still be called hemp and controlled under agriculture? And so far, we're doing great. Good job, guys. So 0.3% dry weight or less. So probably I've beaten that to death, but it keeps coming up over and over again. And I think it's worthwhile to know. So now I'm going to shift away and talk about cannabis for a while, because I don't know how old you all are out there, but I was in high school in the 70s and 80s, and marijuana was around in the 60s and 70s, and that is not today's marijuana at all. Today's marijuana is a lot stronger. You have rolled joints, you have bongs, which are, you can have little water pipes, or you can have great big pipes that are bongs, and basically you're pulling smoke in the water pipes through the water. A lot of people think it makes it a little bit cleaner what you're inhaling, less garbage and junk that you're inhaling into your lungs. And then you can have blunts, which are like hollowed out cigars. And a lot of folks are using vaporizers, which are, some of them are big contraptions, but others of them are very similar to e-cigarettes. So if you've seen an e-cigarette device, you've seen something that people smoke marijuana in, and we'll talk about that a little bit more as we go forward. The other thing that we see at the Poison Center a lot more, so when we talk about, and I'll hit this more a little bit later, most of the smoked and inhaled marijuana, a lot of times at the Poison Center, we're seeing people who come in for all kinds of reasons, and smoking marijuana at baseline is just part of their multiple problems. Sometimes we get legal questions or questions about why is this screen positive. But some of the other smoke or inhalation types of problems we have to do with people using such ridiculously high amounts all day long, repeatedly for days, weeks, months, years, that they develop problems where they can't stop vomiting and things like that, or they're having some psychosis and those sorts of things. The other thing that we're seeing, which I'll also talk about a little bit later, is you might remember hearing about the EValley, which was the e-cigarette thing that was hospitalizing all those mostly young people and led to some deaths and very serious illnesses. That was, we think, due to marijuana, actually, not due to just e-cigarette, nicotine. So we'll talk more about that, but we are seeing some people who are heating up highly concentrated forms of marijuana with all kinds of other things in there with it, and having some of what looks like lung injury, and coming in with shortness of breath and chest pain and things like that. And it's like a lot of other substances of abuse, and we'll call it substance use disorder, right? But substances that people use to get high, a lot of times their high is so much fun for them that even when they're having adverse events that are clearly related to what they're using, they still keep using because they really want it that much. So, problem. The other thing that we're seeing really a lot of is orally ingested THC, and the marijuana products that are in food was mostly cookies and brownies with the medical marijuana, and before recreational was really getting moving. And now I'd say the most common thing that we have are brownies, cookies, but especially with kids, nerd rope, gummies, and things like that. So a lot of candies and chocolate and things like that. So I'm going to show you some of what those things look like, and we'll talk about those and why that can be more of a problem than smoking. And then all the concentration of products and extracts and things like that. So, marijuana is not just a joint anymore. It comes in a million different forms, and the lack of familiarity with how the forms work is causing a lot of what I would call a poisoning. And anything that makes you sick in any way is a poisoning. Mostly we think of that as things that make you sick enough that we need to help you. So I talked about the potency, and I'm just going to point out this chart here. So if you look over here, it starts in 1995. It's a percentage of THC in a marijuana plant, right? So, and I'm not talking about the hemp that people are using for rope and fibers and seeds that you can buy in the grocery store. I'm talking about marijuana that's grown for people to smoke it and get high. So remember, the hemp was 0.3%. Back in 1995, on average, there was 4% of THC in your marijuana. And if you go back to the 60s and 70s, you can continue, if you can see my mouse, it would have been even less than this, right? But if you look, we have the 60s and 70s, and up to the mid 90s is 4%. And look where we are in 2014. I'm just going to point out that was 6 or 7 years ago now, and this product is not getting less potent. We're probably up around 14% now. But, in a period of 95, 20 years, we go from 4% to 12%. I think we're probably around 14% now on average, but it's all over the map, really. I can't even pick a percentage, and I'll show you what I mean in a minute, but it's just very, very potent. So smoking a joint today or a hit off a joint today is nothing like it was 10 years ago or 20 years ago. You know, it's just very different. Now, the other thing that's important is I've told you that I think that the CBD probably mellows out your THC high, leads to a little less agitation, anxiety, and paranoia, and just the unpleasantness that comes with THC. And so if you look back in the 90s, this was a ratio of THC to CBD. So the higher this bubble goes, the more THC and the less CBD you have compared to how much THC is there. And what you can see is in the close to 2010, all of a sudden, we started making a bunch of marijuana plant. You know, this is altered by people who are growing the plant and making deliberate changes so that there will be more THC, which seems desirable. People want the THC for the high. Most people are probably not thinking, well, gee, the CBD is important if I don't want to have a bad high, so I should make sure there's enough of that. And I do think that the higher amount of marijuana, so you're getting a bigger dose and less CBD on average per dose of THC, is part of why we're having more people with more problems showing up for care in the emergency department or other places. So I think these things are very important. And I just want to show you that little sort of white paper joint that you used to see. Look how modern this looks. And so here's some dried plant material, you know, the buds, flowers, resin. This looks a lot fancier than the joint, and I just pulled this off the website of a local seller. They're the first ones that came up because they started with A. They're one of many that are out there, and most of them have products that look like this, but it's a very nice looking joint that you can buy pre-rolled. And this is like an e-cigarette device, right? You can vape in this. And a lot of folks like vaping their marijuana these days. So how do you vape marijuana leaves? Well, there are some products that are specifically made. Pax is one of them, that you can actually load. You know, some are made for plant material. A lot of them are made for liquid or other material. And so you can buy them in liquid forms, right? And put them in your vaping device. So what are these concentrates? Look at these. They look like honey. They look like powder. Some of them almost look like crunchy glass or peanut brittle. And, you know, they come in anything from a liquid to a very hard, crunchy substance. This one actually looks like mustard. And so these are resins or oil. You've probably heard of dabbing. So this is what you dab with, this kind of stuff. Butane, honey oil. I think I described to you before. You can take you can find YouTubes and other videos online that show you people going out to their outdoors, or if it's Maine and it's the winter, they might go into a small enclosed little shed or something, and they pack the marijuana in a little cylinder, and they run the butane through it, and out the other end comes this very concentrated liquid, and then you evaporate or heat off some of the excess liquid to concentrate the THC down to, I told you, joints used to be 4%. Now they're, you know, 12 and 14% and whatnot. When you concentrate it this way and put it in these other forms, now we're up to 40 or 80% THC. That is huge. And you really can't compare a hit off of that with a hit off of 4, 10, 12, or 14% plant material. Now, smokers can adjust how much they smoke. It's why if you give a cigarette smoker a reduced nicotine cigarette, a lot of times they can get just as much nicotine out of it by smoking it in a different way, longer, deeper. You can totally adjust the amount of drug you get in, which is why the people who smoke this do a little bit better than the people who eat it. When you smoke it or vape it, you immediately get that effect within minutes. And so when you start not to feel too good, gee, the room's spinning and maybe that's too much, you can stop smoking your THC. With orals, there's a big delay, and you can eat a whole bunch before you have any idea what it's going to do to you, which is part of the problem. But, you know, I think the message to take home from this is if you hear about dabbing and what is shatter, butter, honey butane oil, or butane honey oil, really, my staff make fun of me, HBO versus BHO. I'm so out of the loop. And then you can see why they call it wax or shatter or butter, because of the different hardness of it. But the important part is just it's super concentrated, and you can load it up in pipes or vaporizers or e-cigarette, things that are meant to be used for nicotine. The hazards, Colorado started seeing this right away. You can imagine butane is lighter fluid. It can, when you put it through your marijuana, it's going to be escaping all over the place, which is why it's good to do it outside. If it's cold and you're in a tightly packed shed, anything that escapes is going to be all around you inside the shed with you. And if you light a joint or a cigarette, it's going to explode and you're going to get burned. And so Colorado had some nasty explosions and burns from people who were extracting their THC and being a little bit careless in the shed or small enclosed area where they were. The other thing is, there are concerns about residue of butane and other things. And, were there pesticides in the marijuana, and is that getting concentrated in here? So, it's a great big experiment. I'm very concerned about the actual THC and what that does to people, which we'll talk about. But I'm a little bit more concerned even about, well, I'm less concerned about the other stuff, to be honest. The THC concerns me enough. I'm going to pick up the pace a little. These are I just wanted to show you some pictures of what this might look like in a medical marijuana shop that might have THC or CBD in there. This is edibles. So you can look on the left is a Reese's or a Nutella. On the right is Nutella or hashies. And these products can have up to 200 milligrams of THC in them. I'm going to tell you a dose for beginners, 5 or 10 milligrams, probably 10 milligrams of THC. So if you ate a whole candy bar as an adult, that would make a very nasty high for you. For a little kid, way worse. And little kids will eat a whole candy bar. Why wouldn't they? And for a little kid who can't read yet, how's a 2 or 3-year-old going to know the difference between these two things or these things? The companies started getting on these guys for selling this stuff because you can see, I mean, look at these gummies. Why would a kid not eat this, right? And then these are one of our most common ingestions for little 2-year-olds and whatnot at the Poison Center are kids eating gummies. The left is Sour Patch Kids. Those are delicious. I got some the other day. They're wonderful. And here are Stony Patch Kids. So yes, they're stony, and yes, you have red-eyed little soldier in there and marijuana plant leaves, but I'm going to say little kids aren't going to know the difference. And quite frankly, based on my experience, adults can't always tell the difference either. And then Nerds ropes. So on the left is a regular nerd rope, right? I tried these. I never had them before, but we keep getting calls about kids eating nerd ropes with THC in them. So I thought I'd better know more about it. They are delicious. Soft licorice stick-like or gummy stuff in the middle with crunchy little tiny nerds on the outside. But this is the marijuana product on the right. It says medicated. There's a little sign over here that shows you this, and it talks about THC over here. But what you see is Nerds rope, and it looks the same, So little kids and even older people can make that mistake. And just more candy bars and more lollipops and, Butterfinger, Keef Cat, Twixt. I have to say these are some very inventive names. The Three Rosketeers instead of the Three Musketeers bar. You got to give them credit. But all this stuff looks really good to eat. And some of the states will restrict it to 100 milligram portions. And I know that it's supposed to be in opaque packaging, but based on the calls we get, I don't know where people are getting their stuff, but I think who knows, maybe they're getting it from outside. We don't know, we don't care, but they're getting it. So since this legalization and the rapid increase in poisonings that we've been getting in little kids especially, but also adults having more troubles, the kids are basically eating the brownies, the cookies, the gummies, and the candies. Adults are coming in with cyclic vomiting syndrome. That's when you use a whole bunch of marijuana repeatedly all day long every day, and you just can't stop vomiting. It's causing some what we believe is exacerbation of people with psychiatric issues, so making their anxiety, depression, and psychosis worse. A big dose will make you psychotic. Even a healthy person, that's a common effect, anxiety and psychosis. A person with underlying psychiatric issues, they're anxious, they're depressed, they're having psychosis. Small doses in the beginning might make them feel better, but in the long run, it's probably counterproductive, kind of like alcohol. If you have a drink, it relaxes you. If you drink all the time, you tend to be anxious all the time. So it can be counterproductive, and that doesn't even get into car rashes and the burns that we talked about. THC, the tetrahydrocannabinol, it acts on CBD receptors that are actually in your body. It's a stimulant and a depressant, so you get kind of a stimulation and a relaxation effect all at the same time. When kids get really high doses, it can put them, they can sleep for 18 hours sometimes. That's not uncommon for us to hear if they get a big dose. And we talked about getting the ratios. So an important message on this slide, because I'm going to go much faster now. Smoking marijuana, you're going to get your peak effects within 15 minutes. You're going to have your peak, that's your blood level. You're going to get high right away within minutes, but your biggest high is going to be in about 30 minutes, which is actually after your blood level is coming down. And you're going to be really high for 3 to 4 hours. There are effects that go beyond that in terms of your cognition and what you're safe doing, but the really big effects come in the first 3 to 4 hours. If you eat it, it's completely different. Your peak effect is not for 1 to 7 hours. So if you eat a whole candy bar, you're not going to notice it for a while. That's your blood, your peak blood. Your clinical effects might show up within a half an hour to an hour and a half, but they're going to be their worst at about 3 hours. So anywhere between 2 and 4 hours at your peak effect, which is how people eat so much and don't realize it and then get into big trouble. And it lasts for 4 to 12 hours. I've had people say they were high for a day or more just from one episode of eating marijuana because they ate more than they should, not knowing. I can't say enough, if you have folks you work with or advise who are going to do edibles, one, slow, wait 3 hours at least, and see how it's going to affect you, because otherwise you're going to get into trouble. And don't be starting with a 100 milligram dose. 5 or 10 milligrams is the most a naive adult should really do. Shoot, what happened there? Okay, so after ingesting an edible marijuana product, what are the likely times to peak in duration? So you eat a brownie or you eat some gummies. When are you going to have your peak effect? Not peak blood level, but when are you going to have your peak effect, and how long can it last, just on average? Okay, so we know you're not going to feel it in 10 minutes, and no idea is fair. So a lot of, and it's less than 6 hours. So you could feel something in 30 minutes. 2 hours is more common for your peak. 30 minutes is possible. And 6 hours duration, it could be. 8 hours duration is more common. So I'm happy with the answers B and C. Both of those are possible. And I'm going to tell you it could be longer than 8 hours and longer than 2 hours. So those are good answers. So at least you're in the ballpark of it's long, and that's the message I want you to get. And it's variable. So as soon as these products hit the market, you can see here, this is from Colorado, and our Maine picture looks very similar, except it's more recent. So you can look at, these are states that don't have legalization. So you can see not very many kids getting into marijuana and getting poisoned with it. And then you can see in Colorado what's going on here. And what's going on here is as soon as the Justice Department said, your state's legalized it, it's federally illegal, but we're not going to come and get you, all of a sudden people had more of it in their homes, and so more kids got into it. And then as soon as they legalized recreational, it just took off like a rocket. And our kid cases are going up and up and up and up. Same with animal cases. So how medically concerning is ingestibles of marijuana in children? I haven't told you. You can guess. So this is what is your baseline knowledge? No big deal. They get a little drowsy and they might fall. Occasionally causes drowsiness that would require admission and observation. Can cause seizures or require an intubation because they're not breathing well enough. Has caused a handful of deaths, and we really don't know. So I see most of you are settling on C, with some of you settling on D, and nobody's picking any of the others. So I'm going to tell you that C is probably the best answer. B applies, and it actually hasn't caused a handful of deaths in kids that we know of. However, there has been a death reported in Colorado, and I will tell you I'm aware of another death that I don't think marijuana killed the child, but I think that it contributed. So really, it mostly doesn't kill children, but it can cause seizures. It can lead to you having to get intubated and need help breathing. And most of the kids, either a small number we watch at home with Poison Center helps them, parents make sure it's safe. Most of them end up in the ED. Some of them end up admitted in the ICU, and we do occasionally have to intubate them, and we do occasionally see seizures. So most kids are getting drowsy. They can definitely be, you know, not coordinated, so they could fall and hit their head. Sometimes they get agitated and scream and psychotic and clearly are having hallucinations that are unpleasant. A lot of them have a rapid heart rate. Sometimes they'll vomit, which is concerning if they get drowsy because we worry sometimes that they'll choke. Seizures aren't common, but we do see them. And some of them get these weird muscle movements and rigidity. It's unusual to have a very slow heart rate and blood pressure and need help breathing, but it does happen, and we have had some here. And I just talked with some people in northeastern US who said, yeah, I've been very scared regarding having to intubate and ventilate some kids. It's not common, but it happens. So for you guys talking to your people, it happens. It's a big deal. We need to keep this stuff away from the kids. It just takes a handful of gummies to be an importantly bad dose for these guys. So what is a typical edible starting dose, not for a child, for an adult, of marijuana? How much THC would that be? I gave you an idea, right? So some of you would say 2, some would say 5. I was told 10 in Colorado when I went there for a visit probably 8 years ago or so. I think a lot of states are settling on 5 and 10, which is very cautious. 2 milligrams would be really cautious. I think people might not take us seriously if we do that, but it would be safe. And I can tell you some people 2 milligrams might be a better dose. 100 milligrams is a starting dose for someone who's already using pot and a smoker. And I wouldn't tell them to start at 100, but I tell them that they should start with 10 and 100 might be your dose. So lots of right answers here. And you can tell it's kind of variable. So if a Rottweiler or Pit Bull mix eats a marijuana cookie, is it a problem? Or if they have several, which dogs will do. And I did actually have this case, and the people called me from their car with the dog in the car, and they absolutely absorb marijuana, and they will eat the plant too. It's really awful. They shake all over, and their pupils get big. They get very drowsy. And if you talk to people who work for a veterinarian's office, they'll tell you that they're seeing this fairly often. And these dogs cry and whine all night long. They're not having a good time. It's very scary. I'm going to point out they could get psychotic, which is not something you want in a Rottweiler Pit Bull mix. That dog was in a cage when they called me, which is good, but it's just scary and bad. So got to keep this out of the hands of animals. And the animals, the kids mostly won't eat plant, although every once in a while they do. It's mostly candies, gummies, and edibles. An animal will eat the plant parts too. So the baggie in the cushion between the couch cushions is not safe, and the dogs will eat that. And for a little teeny Yorkie, it's even for a big dog, if they eat enough, it's a problem. So what about adults? What happens when an adult has too much? Because that's probably what you're wondering. Drowsiness and dizziness and lack of coordination. Totally not safe to drive, operate machinery, and that kind of thing. Fatigue, weakness, and muscle twitching, giddiness, anxiety, and agitation, and altered mood. It can make you very anxious and paranoid, especially with edibles in a bigger dose, and especially if more THC and less CBD. Some numbness, tingling, eye burning, itching. You guys know that red eye look. And you actually can get upset stomach and vomiting with this, and then shortness of breath and sweats and chills and stuff like that. So, you know, it can be unpleasant for adults. It's mostly related to what the dose is and how used to it they are and that kind of thing. In a study studying oral edibles, looking at, you know, we might use this for cancer, nausea and vomiting, and people who don't feel like they can eat meat and increased appetite. Lots of laughing, a lot of anxiety, detached feeling like things aren't real that are all around you, totally unable to do anything psychomotor if you get a high enough. Really, you shouldn't be doing any driving with this or anything that requires dexterity or balance. And some irrational anxiety and paranoid delusions and suspicion and stuff like that. And sometimes there's like a double peak. They'll get sick in the beginning and then they'll start to feel better, and then around 6 or 8 hours or something like that, they'll get sick again. So that's what can happen. And in Colorado, they had cases of kids eating edibles, and one kid jumped off a building. Another kid basically, you know, this is one kid in particular, but they're kids that run through things, jump off things, and just do irrational things that we really believe are related to paranoia, related to marijuana. So this hyperemesis syndrome, that's basically just vomiting and vomiting. These guys get bad enough that they sometimes are dehydrated and need intravenous fluids and electrolytes. like sodium and potassium and magnesium and things. And so we need to treat them, and they'll present repeatedly. It's hard to treat them. A really hot shower is helpful. I think I put that on the next slide. Yep. Or we can rub red pepper on your body, and that seems to help. The only thing that really fixes this is you have to stop using marijuana, or at least cut way back. And they don't seem to want to do that, even if they come into us a half a dozen times with the same problem. People sometimes burn themselves because they make the shower so hot to try and make them stop vomiting. It's that unpleasant. The other thing is most antiemetics don't work. So we have all kinds of cancer anti-nausea medicines, and they tend not to work. There's an antipsychotic, haloperidol, that actually has some efficacy. It doesn't work great, but it's better than the other choices that we have. And droperidol, which is a drug that is sometimes in the emergency department that's similar to haloperidol. But other than that, you just have to stop using it. So what are we going to do if someone can't stop puking after just repeatedly using huge amounts of marijuana all the time? Do we want to give them more cannabis? Do we want to tell them to just wait and stop using it? Do we want to give promethazine and ondansetron are typical antiemetics? And yes, so B and D are the absolute correct answers. They really need to do B. In the meantime, you can try D and see if it makes them more comfortable, and it kind of works. So those are the correct answers, and now you know. So drug interactions to tie out marijuana so we can get to CBD. So anything that makes you drowsy, marijuana can make that worse, can make you more unsteady, very unsafe to drive with alcohol and marijuana. Stimulants can increase your heart rate while you're using marijuana, and maybe even your blood pressure a little bit. Together, it's a bad combination. So amphetamines, cocaine, and stimulants. Anticholinergics, it makes your mouth dry and stuff, and so that's not the best. And they can make you dizzy and drowsy. And then some antidepressants, some of the effects are enough alike that it's just not a very good combination in America. And the marijuana can make some depression worse and anxiety. So bad idea for older adults. They get uncoordinated and are higher risk of falls. It's not good when they have altered perception. I'm telling you, it's unpleasant for them. We get those calls, and we can't make it go away for hours. We can give them a little bit of sedative so they're less anxious, but it doesn't make it go away. And it's hours that they have to deal with that, 12 or 24 sometimes. And their blood pressure can drop when they stand up, which can make them dizzy and fall and hit their head. It can interact with all kinds of medications in a bunch of different ways and exacerbate anyone with a heart condition or blood pressure issues. So, you know, not the best choice of a drug to start messing around with for an older adult. And that's where that 2 milligram strength, if you're going to do it, would be maybe a good idea. I just wouldn't do it. With everyday users, problems with memory, concentration, learning, anxiety, problems sleeping, even though that's what sometimes people use it for, it actually causes sex problems in long term. And if you're smoking these things, smoking is never good for your lungs. And we think there's an increased risk of stroke or heart attack, but the medical data on the long-term outcomes are very bad. So take all this with a grain of salt. We think this, we have some studies, but none of it's very good. You can get cannabis withdrawal. So if someone says, oh my God, I'm withdrawing from not using cannabis and suddenly stopping, it happens. Anger, aggression, and irritability and anxiety. Your appetite is bad and you have all kinds of trouble sleeping. And some people actually get sweats and chills and get very depressed and physically uncomfortable. So cannabis withdrawal is real. And someone asked before, there will be slides for you. You'll get everything I'm giving you, you'll have access to afterwards. So just try and, you know, listen to my fast pace. I have so much information I want to give you fast. So on the right in red, craving, restlessness, nervousness, irritability, anger, and depression, pretty typical of withdrawal of a lot of agents. It usually starts within 1 to 3 days. It's worse within the first few days. It'll last at least a week or two, and you might have trouble sleeping for a month or longer. So it's a real thing. It's not dangerous. There's really not any very good treatment for it. You can call us if you have a patient who's really suffering, and we'll look to see if there's any new information. But all the treatments that have been tried are not amazing, so I can't say that I have a magic bullet for you here. It's not dangerous, it's just unpleasant, and it is real. It's going to be worse and more likely the more marijuana you use and the more abruptly you discontinue, like all things that cause withdrawal. I just want to mention the EValley epidemic, which is the e-cigarette and vaping product use associated lung injury. It was before COVID, which is why you don't hear about it now. There were almost 70 deaths when we looked a year ago, and almost 3,000 cases. and it was a diagnosis of exclusion. A young healthy person comes in and has some serious lung problems that you can't figure out why on earth they would. And what it was is cough, shortness of breath, and chest pain, nausea, vomiting, diarrhea, and sometimes they'd have fatigue and fever and weight loss, and they'd start getting a little bit sick and be dangerously sick very, very fast. And when you look at their x-ray or their CT of the lungs, it looked like ground glass white things in there, which is not how lungs should look. So, and it was on both sides, and just awful looking. And at first we didn't know what it was. We thought it was all related to e-juice and e-cigarettes and the devices. But as we were, and a lot of kids weren't telling us the truth about what they were doing. But as more and more time went on, it became obvious that almost all these cases were probably associated with vaping, marijuana, or CBD, and that a lot of the products, when they could trace them back, had vitamin E or other kind of ingredients in there to put the CBD or the THC in. And so we thought that's what it was. So vaping, smoking of THC and e-liquid, and in the end, the CDC's best guess at what this was is THC with a heating element in vitamin E acetate that kids were vaping. So this EValley that everyone was blaming on e-cigarettes was just a vaping device, and it was probably a combination of the heat or the heating elements with THC, and especially a lot of it, we think, vitamin E acetate. So that was a marijuana-related problem, we think. So let's talk about CBD in the limited time we have left. It's going to be short because there's not a lot to say, and you'll have the slides. Messages to take home. Prescription versus non-prescription is completely different. The CBD that they use for seizures is 10 to 100 times higher dose than you can buy. You cannot afford to buy enough CBD over the counter to get anywhere near the prescription drug dose. So the prescription drug dose is 10 to 50 milligrams per kilogram a day of actual CBD. And if you take that high of a dose, it causes drowsiness, diarrhea. It can damage your liver. It actually damages liver cells. And it's not very psychoactive. You don't get a very good high from that, but it can cause drowsiness. Most of the people were very tired, sleepy, and having nausea and diarrhea. How much CBD is in your CBD? When in the UK, a group looked at this, and this is kind of not a study that I find in the usual places, but 10% of the products had 38% of the products were within 10% of what they advertised. Most of them advertised 4.5%. Most of them had 3.5%, which is way less. And the THC content was 0.04% in 55% of the products. And they had arsenic, lead, and other contaminants in there. Probably not in huge amounts, but they were there. So, you know, you don't really know for sure what's in your CBD. Way less is in than would be in the prescription products. And I would say using CBD, you have potential for any of these effects: poor quality sleep and drowsiness and tiredness and upset stomach and diarrhea and liver injury. But to be honest, there's so little CBD compared to what's in the prescription drug product, and all of these effects are dose related. I would not expect a great deal of any of these with what people are buying to use over the counter. If they use a lot, maybe that could happen. Now let's talk about the urinalysis, and I'll close with these thoughts. And you'll get the slides on these. The important messages are CBD products can have THC in there. And so if you use a bunch of, in a study where they gave people 4 weeks of CBD products, some of them with just a little THC in there, nobody really tested very high on the THC, but some of the people had a screen show positive for THC, about half of them, at a cutoff that you would normally use. Now, when they did a confirmation, so a screen says this looks like THC, a confirmation is a more specific test that you do after that that says definitely this is THC. When they did that, almost all of them were negative. So for the most part, if you confirm these out, it's going to be not enough THC to be very positive on your confirmation. So it's something you want to always confirm a positive screen on a CBD user. The other thing, there's another study that looked at, you know, vaping and swallowing CBD. And when they did that, they gave one dose and they tested a bunch of people. Some of the people screened positive, but nobody who wasn't already using marijuana really had a level with this one dose that was confirming at a very high level afterwards. So if you did a confirmation, you'd say, oh, okay, that's probably not somebody who's using. So for you guys, if someone's using CBD and they show positive on their TH screen, should you suspect that they're lying and using THC? Yes, you should suspect that. They probably are lying and they're probably using THC. You should do a confirmation with a second, more specific test to give you a number. And if that's still positive for THC, you should call an expert and talk with them, because now it gets complicated figuring out whether they're lying or telling the truth. Probably they'll be negative, but I can't guarantee it. We don't know how much THC is in the CBD they think they're buying. So if someone comes in for a screen and they say they only use THC and it's, or only CBD, they don't use marijuana or THC, and the THC marijuana screen is positive, what does that mean to you? Definitely, is it that they're using THC? You're not sure. Maybe you should get a confirmation. Good. So that's the message I wanted you to get. It's a lot of complicated data. Okay, so for the most part, CBD crosses with the screens, but not extremely well. Usually you can confirm and see how much THC is there, and usually probably not enough to be THC positive on confirmation, but possible, and you should talk with an expert. Is it possible for CBD in large amounts to cross? Yeah. Should you do a confirmation? Yes, 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 yes. And in the future, in screens, we're going to be looking at THC and CBD, parent and metabolites, and that's how we're going to be able to start to tell the differences on who's lying and who's telling the truth, but we're not there yet. And that's everything I have for you. I spoke really fast, and it's 2, and I'm sorry. If you want to try and send questions, I'd be willing to answer them by email, or I'll hang around for a minute if you want. I'll leave it up to you.
Question for you, Karen, was, I think at the beginning you talked about the cannabis sativa plant, and there was a question, there's also the cannabis indica plants, and are those sort of the same, or do you get the same types of products from those other cannabis plants as well?
Yes, and there are preferences as to which plant to use, and the users will swear to you that there are differences. From my medical perspective, I treat them both the same.
Okay.
In other words, the problems that I see, I would not expect to be substantially different between those two, but the users think there are all kinds of differences that I frankly don't understand. I guess I'd have to smoke a lot of marijuana before I really knew. But I would treat that pretty much the same in terms of medically and the concerns we talked about.
Okay, great. And then somebody's asking, could you clarify a little bit? I think that when the THC concentration in a plant goes up, does that automatically make the CBD, are they sort of, if one goes up, does the other go down, or can you increase both? What's that relationship?
I am not an expert in botany. My impression from what I'm seeing is that it's a deliberate intent to increase the THC without considering the CBD. I think if someone wanted to make a plant that had plenty of both, they could do that. But that's with a caveat that I'm not a botanist. But yeah, I think it was a deliberate concentration that could have been done differently and can be done differently.
Great. And then there was one other question. Oh, I think you shared a little bit of data on this, but do you have data on the increased number of poisoning or THC related poisonings or calls that you get at the poison center since legalization, or do you have numbers?
I absolutely do. And I'd say feel free to send me an email, or if you go to our website, there's a way to put in a request for information. Everybody on earth is monitoring that right now, and we've already done all that work, so we're happy to share it. Way up for kids. And, that's the biggest thing that we see is the increase in little kids getting into it accidentally.